Hi. Hi everyone. So I'm going to do a video today about recovery room nursing, or PACU nursing as some people call it. It stands for post-anesthesia care unit. I'm a recovery room nurse and I have been for 2 years. I've been a nurse for 4 years and it took me 2 years to kind of find out where I wanted to be, and I will never work anywhere else. It's the best place to be a nurse. So if you're thinking of going into recovery room, I know there wasn't many things on YouTube when I had my interviews, so I think this will be really helpful, some hints and tips. So first of all, I wrote down a list so I wouldn't miss anything. The recovery room is just one big room close to the OR. So for those of you who don't know, you get a surgery, you come out to post-anesthesia care unit, so the patients are usually still under anesthesia or waking up. So you're in one room. It's a big fishbowl. The reason why I like it is the nurses are there and the doctors are there. You work closely with everyone. The ratio is 2 to 1. So you have 2 patients per nurse, and it's really nice because you really get to concentrate on your patients, because it's usually one. You never get them both at the same time. They're around 20 minutes apart. The thing with recovery room nurses is you really need to be on fleek and on point about airway. That's the #1 thing. I know in nursing school it's like circulation, breathing, airway is #1. Sometimes they come out with a tube down their throat that they were using in surgery that you're going to have to watch and be at the bedside to take out. And that's kind of the whole point of them recovering right next to you. You're sitting right next to them the whole time, and you're only going to have them for 1 hour because you need to make sure that they are able to breathe and they're coming out of anesthesia, being able to be functional off of a tube helping them breathe. So that's the main thing. Also, what I notice is that in nursing school, we learn about surgery somewhat, but we didn't learn all the surgeries and what they do. So it's important to, when someone says, oh, they had a lap chole, and so you're like, okay, I obviously know they had their gallbladder out, but to really know how they do it and what to watch for will really help you. But no one will really tell you, and you'll kind of look like an idiot if you ask every single surgery, which always ask questions. But this book is very helpful, and it's the only book I purchased, and I look back at it even now, even though I've been in there for 2 years. It's called Surgical Care Made Incredibly Visual, and it goes over all the surgeries. Look, bariatric surgery with pictures. Each one is just a page, so it just gives you what you need to know as a recovery room nurse. This should be like your Bible, and you should, this, and then of course EKG book. But this is very helpful. I really recommend it. It also has some things in the back for recovery room nurses, like stages of coming out of anesthesia, of arousal that you need to watch out for, and encouraging the deep breathing and coughing, why we did that. And the biggest thing for recovery room nursing besides airway is managing pain. And you'll get to know, you probably push, okay, so when you're like a floor nurse or whatever, you have like a million meds because you have to give all these different meds to all these different patients. In recovery room, you're going to have about 3 meds you give all day long. So you're going to know everything there is about them. And it's Dilaudid, Demerol, and Zofran. And sometimes morphine and fentanyl. But the 3 big ones are Dilaudid, Demerol, and Zofran. So really look those up and just get to know those, because that's all you give all day. Most of the doctors have the same orders, the anesthesiologist. It's just give those as pain meds. When the patient wakes up, starts screaming, you know what to give. I have my personal thing. Every nurse has their own, but my personal favorite is Dilaudid, then Demerol, if the Dilaudid doesn't work. And then with the Demerol, I give the Zofran. And they aren't nauseous, and it's like the perfect cocktail. So every nurse has their own thing. My other nurse friend always does 2 of Dilaudid, then Demerol. So you'll figure out what works for you. But just know that and be aware of different types of surgeries, airway, and the medications that you're giving when you're a recovery room nurse. So that's like the main things. Also, let me see if there's anything I wanted to tell you. Oh, the best thing about recovery is the schedule. I don't like being somewhere at 7 a.m. because I like to wake up and do fun things. Like, I like to go to a dance class or Zumba or step class or whatever, you know what I mean. So I like to work noon to midnight or noon to 8. You could do 8-hour shifts, you could do 12-hour shifts, you could do weekends, you could do you know, it's nice if you want to work at 8, if you want to work at 9, because on the floor you only could work 7 to 7, and I absolutely hated that. I hated the day shift and the night shift. So that like really drew me in. Second is call. So you get to be on call in the recovery room, which was something new because I was ER and floor nurse before that. And during call, you make more money, and you make money to sit on your ass because it's $7 an hour waiting to get called in. So it's around $7 an hour. Some hospitals I've heard have paid $15 an hour, and then when you go in, you make time and a half of what your base pay is. So you could usually in recovery room, it's a lot of older nurses that don't really feel like doing ICU, so they go to the recovery room because it's a little bit easier and low-key, and you get your patient out in an hour. So you don't have to deal with the same patients all day. So where was I going with that? Oh, they don't like taking call because they're over it. They don't really need the extra money. That's how I feel, at least in my recovery room. So I like to take call on weekends because that's when they usually let me take it. And if I do get called in, it's nice. I'm usually the only nurse, or we have another nurse there. And when you're the only nurse there, they will usually let you watch the surgeries while you're waiting for the patient, and that's another good way to learn about the surgeries. So just learn about the surgeries because they don't really teach us in nursing school. So let's say they're having a craniotomy, brain biopsy, something like that. You know what to watch out for neuro, but maybe you could even go this step further and know what part they did the biopsy and what to really look out for, which side of the eye, what the pupils, like, you know, everything that goes along with it. If you really want to go above and beyond, I really recommend that book, and it's so easy to read it. I think it took me like an hour to just read the whole thing and just go through it, and I always look back at it. Another thing is, that's it. So thank you so much for watching. If you guys have any questions, just leave them in the comments and I will answer them. And I really recommend going into recovery room. I know you'll love it. If you have an interview, I'm so happy for you, and get really excited because it's such a wonderful place to work. Okay? Bye.